I'd like to call the meeting of the Board of Health to order. It looks like from the gallery on the screen, we have a quorum of members present, so virtually present. There's a script that I'm supposed to read, which I managed to not bring up. And do you happen to have that in front of you, Cheryl?
Cheryl, you're on mute.
I can grab it, Bill. Do you want me to read it, or do you want me to see if I can send it to David to share the screen?
Well, the problem was it doesn't share very well because it has a lot of blanks in it, fill in the blanks.
Okay.
But if you could read it, that'd be great.
Okay.
Bill?
Hello.
Hello.
Mark.
Yes, the script was in our packet for the meeting on 4/16. If you go to the public documents on 4/16, the virtual meeting script is right there, so we can pull it up from public documents.
I have it up on my screen. Do you still want me to read it, or do you want to try to find it from the packet?
Why don't you just read it, Cheryl, and you can give us the Reader's Digest version.
Okay. So good evening. The chair for the Board of Health meeting is William McGinnis. This is an open meeting of the Board of Health, and is being conducted remotely, consistent with Governor Baker's executive order of March 12th, 2020, due to the state of emergency in the Commonwealth and the local state of emergency declared by the Acton Board of Selectmen and the Board of Health due to the outbreak of the COVID-19 virus. To ensure ensuring public access does not ensure public participation unless such participation is required by law. This meeting will most likely, right, Bill, feature public comment. For this meeting, the Board of Health is convening by Zoom as posted on the meeting agenda. Please note this meeting is being recorded, and that some attendees are participating by video conference. We are now turning to the first item on the agenda, but before we do so, permit us to cover some ground rules. The chair will introduce each speaker on the agenda. After they conclude their remarks, the chair will go down the line of members, inviting each by name to provide any comment, questions, or motions. Please hold until your name is called. And don't forget to unmute your mic. For public comments, after members have spoken, the chair will afford public comment as follows. The chair will first ask members of the public who wish to speak to identify their names and addresses only after being first recognized by the chair, and will be afforded a few minutes for the comments or question. That's it. I think we can get going.
Okay, excellent. Well, you can just keep rolling, Cheryl, because you're first on the agenda. So
okay. So I have a couple. I want to start with a couple questions that we have, and I was hoping the board could discuss this, whether this be at Monday's meeting or tonight. Hazardous Waste Day, we had done board action previously to postpone the day. When we postponed it, it was supposed to be May, not this Saturday, the following Saturday. We rescheduled it to June 29th just to hold that, June 27th, just to hold that date. So I'm wondering what the board's thinking about whether we should hold that or not. We also had, we've had a lot of requests from our semi-public swimming pools about whether they should reopen. We're also questioning whether the board thinks it's advisable for us to do food inspections. And then camps are also really questioning us. What we've done so far is tell people to sit back until the governor gives us his update. And hopefully, as he indicated today, that we should have that by the end of next week. The end of this week. So once we get that, I think a lot of those concerns would be addressed. But I just wanted to kind of throw those out there. Governor Baker had a press conference today at noon. We're at, Massachusetts is at 56,462 confirmed cases. He said, as I just mentioned, that he'll decide later this week if he's going to extend the stay-at-home advisory and the non-essential business closure. He said he's seeing a plateau on hospitalizations, and hospitals still have a capacity of about 56% of beds available. We've received about $6.5 million worth of PPEs as of yesterday. And just on a side note, Acton's doing well with our stock. Nursing homes have been a hot spot, he claimed today, and he also said that some of the eastern states, including Massachusetts, Michigan, New York, and New Jersey, account for about 50% of the deaths, unfortunately, in the nursing homes. He also said today that he's going to devote another $130 million for nursing homes, and that'll be available May 1st, and that would be used for cleaning and PPEs for those organizations. He also said that Boston and Mass General have teamed up to test 1,000 asymptomatic residents, and they're going to use those results to evaluate the community exposure through antibody testing. Let's see, and then the other thing, I've been sending out weekly updates, trying to keep people, our businesses and our residents happy. And I'm really trying to push the stay-at-home advisory, which I may have mentioned a couple meetings ago. Then we also had a formal request. So we received a citizen's request, and as we have done previously over the years with fluorescent light bulbs and perfume. And they're asking that we require face masks for all. And if the board would like, I can ask that person submit a proposal and supporting information for placement on a future agenda. That's it. That's all I have.
Okay, thank you, Cheryl. That's pretty good. Well, working backwards, as far as the proposal goes, and sure, if they have something to submit and it's new information or there's new guidance, then we'd certainly be interested in considering it. As far as the things with the swimming pools, the Marty, on the camps, the all of those things you mentioned, it sounds like it would make sense to wait for the governor's update on if he's going to give it to us by Friday, because clearly if the hazardous waste day, I'm sorry, that was the first one. I mean, if it's going to extend into those dates, and we're not going to have them if it's lifted before then, and it's going to be in stages, we have to see what the stages are, I guess. So that would be my recommendation, but ask if members of the board have any comments or questions for Cheryl or.
Cheryl, you mentioned the hazardous waste day. How long can you wait to do that? I mean, it doesn't seem like it's very urgent at this point that it can wait.
No, when we just kind of had them hold that second date in June, we asked them, how much notice we need to give them if we need to cancel that. And they didn't really require a lot. I mean, out of courtesy, I'd probably like to give them a couple weeks, but I think we have some time on that.
Okay. The camps and public pools, I mean, I think we've talked before about the school year, so that we're going to obviously wait for the state advisor from Governor Baker. The question I think that Bill missed was the food inspections. What are you looking for with that?
So we've put them on hold because we really haven't been going into public buildings unless we absolutely have to. But these restaurants and grocery stores, and they're all essential. They're all working, and food safety is a huge concern. We are required by the state to conduct inspections twice a year. We probably had only gotten to maybe a quarter of the first half before, maybe not quite a quarter, but So we're going to be behind when things open back up and to get these inspections done. So myself and my staff, we were just discussing whether we should start going into some. So I just wanted to throw that out and see what your thinking was on that. I mean, we need to still make sure people are eating safe food, even though we have this crisis going on.
Do you think you can do your inspection safely, Cheryl?
Yeah, so what we were thinking about doing was, looking at our list of what we have left to do before the end of June, and potentially trying to do, some of the higher risk ones, some of the more important ones. I think the sundries of the world that people just have prepackaged candy bars or soda. I don't know whether they have to be essential, but yeah, I mean, it's a good question, right? So, staff can go in with, masks and, gloves and anything they need to protect themselves. But, we do have to touch a lot of things for the inspection, which they're recommending again. So, like I said, we're kind of torn. We just, I don't know. I mean, could we do them safely? I mean, Matt and I have had this conversation, and he's willing to do it. So it's just a little risky. That's all.
Can you do I'll call it a a pandemic inspection? In other words, touch less things but at least cover some of the essentials, the observations of, proper storage, refrigeration temperatures, that sort of thing.
Yeah, we could do like just a basic just to cover the the higher risk, protocols for safety. So yeah, sure.
Okay.
Could you
Mark?
also do a document type inspection? A lot of times people have the records of their own, maintenance of some of the procedures and documents of the trainings and logs and things like that. So, and then partly done remotely so you could minimize the time you're in the establishments.
Okay.
You don't have any drones, do you?
No. Yeah, that would be the best. We could sit at home and watch what, that's something we don't really have a lot of time for in inspections is that sit back and watch, right? Which is one of the best ways to do an inspection. So, yeah, that would be nice if we could put a drone through the stores and watch what they're doing.
But, joking aside, as we do these meetings remotely, possibly do part of the inspections remotely with the folks. They could walk around and do a video, as Bill said, a kind of pandemic inspection kind of. And it would also be helpful for the folks because they may have questions, and the inspections aren't just for compliance, it's also for education. So I think it's important that at least you contact the folks and have that confidence and to proceed at least safely.
Okay.
Okay. Other members, comments or questions? Not just on the food safety inspections, which I think, based on Mark and my comments, if you could do, I think some inspection is better than none. So whatever is achievable and appropriate and safe.
Okay.
Other comments from members of the board? Hearing none, ask if there are comments from members of the public, questions or for the health department.
Hold on. I don't think there's any hand raise. No, I don't show any hand raises. I don't think. Let me just go up. Nope.
Okay. Well, in that case, I'll move to the next item on the agenda, which is an update from the Acton Nursing Service. And I see Heather, you're online, so thank you again, as you have done for many weeks, supported us. So please educate us again.
Good evening, everyone. So as Cheryl said, Governor Baker did have some mandated testing for the residential settings, which is really good news. Better news is that Acton Life Care has started doing their residents today. They're doing them in two two shifts. One was 2 pods today, 2 pods tomorrow. And then they're going to set up a plan to do staff, I believe, on Wednesday or Thursday. So they will be doing that, which is great. They still only have 2 positive employees in the that have worked in the building, no positive residents as of yet, which is good news. The other good news is that Robbinsbrook had tested all the residents in the traditional setting that they have. So 57 tests were completed, 56 were negative with 1 positive. And there is actually someone else within the building that is a positive who is, I believe, in the hospital. In the memory care unit, they do have 19 residents. They did test 1 because of some symptoms. They're holding off based on their doctors in the building because they are so isolated from the rest of the building, mainly because it's difficult to test those seniors that have, such extensive dementia. So they're holding off on doing that as of now. But they will reassess that if they need to, obviously, on a daily basis. So that's good news, that there is not an overwhelming amount of positives within either of the 2 congregate settings in town. As of tonight, we have 67 positive cumulatively over the last few weeks of residents in Acton. Currently, we have 27 of those residents on isolation within their homes who are being monitored by our department. So we have been seeing a little bit of an uptick in calls of a nature to take patients who are coming out of the hospital who are positive COVID patients. And as I said a few weeks ago, we were sort of holding off because of the PPE issue, where the majority of it was going to the fire and police as being on the front line. And we have been, using a smaller amount, assessing all of our patients on the VNA side to make sure that they're not having any symptoms of COVID to protect the staff. The staff, of course, is wearing protective equipment, masks and gloves. If residents do have or patients do have respiratory symptoms, we're not sending them in. We're doing telehealth visits. But because of the uptick in calls from referral sources looking for, residents we've serviced in the past or new residents coming home who are recovering after a few week, either they were a positive within their home or they're a positive coming out of a facility. So we did talk, and the fire department, Anita Arnhem specifically came out and did the N95 fit testing with us. We started last week and they finished up today with all the staff. So they have the exact size of the N95 masks that we can wear within the house to make the staff safer. So that's good news also. So Cheryl, just on a side note of you mentioning for inspections, I'm sure fire, specifically Anita, who was just great. She came in today on her day off to get the rest of the staff done. I'm sure she would be willing to fit test your staff so they have the appropriate equipment, if and when you go in based on Governor Baker's, opening up in stages. So that's just a little side note. I believe Mark Hald reported this morning that there was another delivery of PPE, so that's good news all around. And we're just holding steady, doing the tracing and monitoring folks within their homes. I think that's about it for me.
Okay, thank you. I can't think of anything you missed, so just ask members of the board, any questions or comments for Heather?
Hi, it's Joanne. I have a question, and I apologize for being a little bit morbid, but all these meetings, you've been giving us wonderful updates, but you have not mentioned anybody dying from COVID. So I just wanted to know if the town has those records.
So the state originally asked us not to share that information county or by so I'm going to leave it at that.
You broke up there a little bit, Heather, but I think what I heard you say was the state asked you not to share that, and so you're not going to.
Yeah, initially that was what they asked us to do, and I personally feel as a clinician and to keep folks' privacy, as if anything shows up in an obituary, I don't want to be the person to say that was the reason behind this person dying a specific day.
Okay, thank you.
Other questions or comments?
Thank you, Heather, for all the updates and all the hard work. 2 questions. Are you still doing fine with the contract tracing, or is there anything else that you need?
No, we're doing good. We always run into issues with contact tracing at times. I always remind people, and especially in this kind of forum where we've been doing a Java with John on Fridays, that I remind people in the community, if you do get a call from anyone and you're not sure of where that call has came from, go onto the website, the town website, look up our phone number. Between Cheryl's department, she has a different phone number than our nursing department, but one of us will get you in touch with the person that called you, regardless of who you call back. I did have another call today with a resident who questioned, who I was. And I said, I'm going to let you go to the website, you look for the information, and you call me back, and this is my name. So it's good that people do question it, because there are a lot of scams going on. So it's definitely, that's probably the biggest thing we run into when we're not getting a hold of people, because the state or the labs that are putting in results aren't putting in phone numbers, maybe because a resident didn't write it down. We do have some avenues that we've been using to get phone numbers for people. So it is going well.
Good. Would it help on the website to have some sort of link or some sort of information of where to report, or if you have a question about it, to write to the nursing service or with an email or a specialized email just for this? Would that help you at all?
I think there is a specific link that is on there. I'll have to look again, because the look of the website changed a little bit a couple weeks ago. But I thought there was a link specifically to our department with the phone number listed at the very top, I believe, of the website when you go into the COVID-19 information. I can double check that it's still there, though.
Yeah, maybe on the ANS part of the website too.
Sure.
Okay, the second question, we've heard comments from the public about the number of cases that are resolved, in other words, that are no longer active. Do you think that's a piece of information we should share weekly or something?
So I've been getting a lot of questions about that, and I have been sharing it, but it hasn't been going on the website, but it is going on tonight. So that will be listed as of tonight.
And I think, Heather, you actually said it's 27 active cases currently.
Correct. Yes.
I mean, obviously the math is a differential that are resolved.
Presumably.
Correct.
Okay. Hopefully. All right. Thank you very much.
All right. Other questions from members of the board?
Yeah, Bill, this is Mike. I had one question. Heather, have there been any town employees or contract employees that have tested positive?
Not that I am aware of, no.
Oh, that's good. One thing I would point out is, like, my company Pfizer has a contact tracing program where, when you go into the site, you're required to keep a log of who you contact with. Therefore, if you did come back positive, we'd be able to trace back who you were in contact with. Do you think that would be something that the town of Acton could implement?
That's a good question. I'm not sure. When we do our contact tracing, and reach out to anyone that has been in direct contact with a positive case, if we know they have gotten tested because they are symptomatic, we do ask them to start thinking about that symptomatic date, the 48 hours before, and anyone they've been in contact with in case it does come back positive, because that just gets a jump on them thinking about it and writing it down, so that we can get it all the faster if their test does come back positive. Anyone that's asymptomatic right now, who has been a contact, typically aren't getting tested, that I have seen. It's only the folks that are symptomatic whose doctors are sending them.
Okay, I guess should the town institute a policy of when they're in contact with other people on their job, should they keep a log of their contacts just in case?
I don't know if we could make a policy like that. I'm not really sure. The positive thing is that most people know where they are every day at this point, because there's so much, quarantining going on where everyone's doing the stay-at-home advisory. If they are going out, it's to their place of business. So other than that, that's been, the positive thing about contact tracing right now, because so many people are following those regulations. I don't know the answer to that. That might be something that you want to bring up with the town manager.
Okay, maybe I could think about that and put together a proposal.
Yeah, I'm not really sure how that would work, but it's definitely a thought.
Okay. All right. Thank you. Dr. Bill, Rika, Tom, anybody have other further questions or comments? Okay. Dr. Taylor, I see you just unmuted. No, now you muted again. Okay. I see you're back to mute, so I'm going to assume that means no questions or comments. Cheryl, any questions or comments from members of the public?
I have two. Call in user number 1.
Tara.
Go ahead.
Hi, it's Tara from West Acton, and thank you both for all of your help and your caring. I hope you are taking care of yourselves. I have a couple questions. First one is, what percentage of all the nurses have been tested?
Hi, Tara. Our nursing staff, none.
I didn't hear.
Are you talking about the town nursing staff?
Yes.
None. We haven't had any testing.
My next question is about the opening up. Does the governor really have any authority to open up stores that are in Acton?
So, Tara, I'll take that one and just say that's probably not the Board of Health's province to issue an opinion. He had the authority apparently to close them, so I guess he could unclose them, and what happens after that, we can have further discussion. But
okay, the reason I ask is that I believe that under municipal authority, he can close them for a state of emergency, but he cannot force them to open. That it's up to the Board of Health. So that's why I think it's in your jurisdiction. And the last question was about I wasn't looking for an answer now. It's a rhetorical question that I hope that you do some research on, because I don't think we're anywhere close to opening. And this idea of 25% capacity is one thing, but, I passed the rug store the other day up in 2A. It looked like they were open, but I never see anybody in there. So it's like, okay, whatever. But, even at 25%, I'm very concerned about, when you get to a door. Now, people have to stand back, and there has to be a process. But if somebody else is coming up, this is what happened to me in Trader Joe's before they did the line, is that I was walking towards the door, and somebody else was coming up, and I was trying to step back to avoid getting too close. And the other person crashed into me and pushed me into the other person. So instantly there was 3 people being contacted, which could have been avoided if there were proper practices. So I don't think it's just capacity. I think that there's process that needs to be in place. Then the other thing is just sort of a question. I wasn't really sure what you guys were talking about. Are you talking about contact tracing if you enter a public building, or is that contact tracing of employees of a public entity?
I think that was a suggestion from Mike, which he's going to research further. So I'll let him make it. But the contact tracing, I believe that Heather was speaking of, is people who are determined to be COVID positive. She assesses who they've been in contact with to make sure that they also quarantine for the required number of days.
Okay, so this wasn't about like after we open the public buildings and then trying to contact trace who's doing what to who when there. That's not what you were talking about.
Well, I don't want to put words in Mike's mouth, but
Oh, okay. So I try to keep track of who's talking.
And he can certainly speak for. But I mean, it may be that that's sort of in line. He's suggesting that the town employees, once they start meeting members of the public, might want to keep a log of who they met, just in case someone in that contact tends to be or turns out to be COVID positive, either the member of the public or the member of the staff. And further than that, though, like I said, I believe Mike said he'd come back with a specific proposal. Mike, you can jump in at any time.
Yeah, I mean, understand, like, the way we get past this is through testing and contact tracing. So my concern was more for the town employees, because that's who we, can institute policies for. But I mean, in general, this needs to be town focused, collaboration with other towns, and ultimately consolidated with the state direction on this. And I'm hoping Governor Baker will come out with a proposal to have us going forward on this.
The reason I ask is because I'm concerned if somebody wants to go into a public building, a library, for example, and I would be very sad if they had to show an ID to get into the building, to access public resources, do you know?
Yeah, that's not what contact tracing is about.
Okay, thank you.
All right, thank you, Gerald.
We have one more. Let me just mute her. Paul Guerin.
Please go ahead.
Paul from School Street. Just a question to Heather. We had about, from April 1st to April 21st, I think we went from 5 to 45 cases, so an average about 2 a day. And it was pretty flat, with the variability you'd expect, but it wasn't really an uptick. And then the middle of last week, we had like 3 days in a row where I think we averaged like 6 cases. I know it's now flattened back out again to 1 or 2, but do you have any sense of whether, I know you answered this question last week on the Wednesday meeting, that there was really no big clustering that you can see in Acton, which is, good news and bad news, because it's, you can't really pinpoint a set. But was there any sense of what happened last week that, we had kind of an unusual 18 cases in 3 days, and whether there was some kind of clustering going on, a family or something, or whether it was still pretty diffuse?
Hi, that's a good question. I think part of it is because they're doing so much more testing within the state, and people are coming back as positives as more testing is increased. There's no cluster specifically with any of those cases. They are scattered throughout town.
You said before, though, that it's still mostly with symptomatic people, that, people aren't really getting tested unless there's some symptoms. So, is it growth, or is it kind of like more even symptomatic people were having trouble getting tests previously, and now it's more accessible? Or are they starting to even test a lot more? I know you mentioned some of the resident programs that were getting tested now. So, is it kind of still mostly symptomatic people that are getting tested, or are some of these people coming up as people that are being targeted in certain areas for certain high risk groups that end up coming positive even though they're asymptomatic?
There are definitely some asymptomatic positives within town, and those are coming back specifically from congregate settings that are outside of the Acton town.
Got it.
Yeah.
All right. Thank you.
Thank you.
Thank you.
Okay, so let's turn our, well, actually, I'm sorry, Mr. Martin, did you have any questions or comments?
No, Bill, thank you.
All right, thank you. Let's turn our attention to the next agenda item, which is refers to the farmers market. And let me just frame this a little bit. The farmers market, which you may or not know, is held in the summer in Acton, and they're proposing to implement some procedural changes as well as a location change, which would require Board of Selectmen action. So what is before us tonight is a recommendation to the selectmen. So at least as I understand it, they're not asking us for any variance or special conditions or otherwise, but the selectmen are looking to us for a recommendation as to whether or not we think this is appropriate or not appropriate. So,
Bill, may I say something quickly?
please.
So at our last meeting, last Board of Selectmen meeting, they asked for permission to use the Pearl Street during the summer. And the Board of Selectmen was hesitant about that because of the cramped quarters on Pearl Street. It's literally very difficult to walk from booth to booth, even if the booths were spread out more without bumping elbows with someone. And so we asked the manager to come up with, work with the farmers market people to come up with other ideas. And we wanted to run the ideas by the Board of Health to get your take on it as well.
Okay, very good. Well, thank you. And Joanne, did you want to say something?
I do want to say something. I'd like to disclose that I am a member of the Farmers Market Leadership Board. So I am, if there is a vote, which it sounds like there's not, but if there was a vote, I would abstain from taking a vote. I was planning on leaving the meeting, but I will instead just listen on, and if there's any questions for clarification, I'll be happy to help the other leadership members answer. There are other members on the call who will be mainly presenting and answering questions, but if it's helpful for me to stay on and only I know the answer, I'll be happy to answer it, but I'd just as soon take a step back. And again, if there is a vote, I will abstain from voting.
Okay, very good. That sounds quite reasonable to me.
Hey, Bill.
Yes, Mike.
It's Mike. So, Joanne, if you're recusing yourself, should we get Rekha or Tom as a replacement vote?
So, a good question, Mike. Something I thought about. I believe if Joanne is abstaining from voting, if there's a called vote, she can still participate in the meeting. So I wasn't, and once this agenda item is completed, I presume Joanne would rejoin the meeting as a full member. So unless we have a tie vote, I wasn't anticipating on bringing in an alternate. I don't know precisely what the rules are, but that's kind of how I was going to approach it.
Bill,
Yes, Mark.
it does seem like it is a new item which was just added, and it does not seem like there's a time crunch to get this voted tonight. And the third thing is, it sounds like it's a preliminary plan. So I think there isn't a vote required for the board. So I'm not really sure we have the conflict. And of course, in these times, having a remote meeting with a conflict, how do you leave a remote meeting of the room is kind of a novel question. So I think,
yeah, I thought
we
we
don't
didn't
take a vote. I don't think we have the conflict. So if it's only guidance at this point, so I think probably if we just issue guidance but don't take a vote, we can obviate that problem. If we have to, we can check with town council about it.
I would agree. I don't see a conflict either. But okay, well, in that case,
Getting back to so I guess I'd ask Cheryl, what are you looking for tonight? It sounds like the selectmen are looking for guidance and input. Is that correct?
Yeah, we asked the farmer's market to submit the plan for safety protocols, which you see on your screen right now. They've submitted that to our satisfaction. The discussion, as David said at the last Board of Selectmen meeting, was trying to find another location. So they've identified the Elm Street location, and the farmers market group is on board with that location. So we're looking for, I guess we can just do a recommendation to the Board of Selectmen that we approve in concept of their protocols, and the new location would be okay.
So, Bill, may I say something again?
yes, please.
So two things. One, there is a little bit of urgency here. I don't know that it absolutely has to be, well, it certainly doesn't have to be finalized tonight, but the farmers market has to be commit to the vendors, mostly farmers, that they will have an outlet here during the summer. And so if they can't submit, the farmers are, need to decide whether to go through the expense of planting crops or how much they plant or raising, animals or whatever their product is at the farmers market. So there is a little bit of urgency. And second is, I would say that the Board of Selectmen is looking for two things. Comments on this plan if you think it's workable. Maybe you think it's workable, 75%, but you have, problems with this area and that area, or maybe you think it's not workable at all. So that we have an idea of what your opinion is. So if we're like 80% of the way there, and we think the last 20% can be worked out, and you guys think it's like the plan is like 80% of the way there, and the rest can be worked out, then that we can be pretty sure that we can move forward. On the other hand, if you think the plan is 20% of the way there, we have to hustle to get another plan, or whatever we would do. Or maybe you would say that it doesn't look promising at all to have this. So we're very much interested in what the Board of Health has to say tonight, because it will guide the actions probably over the course of the next 10 days.
Okay, well, to keep us all out of trouble, I mean, what we'll do is I can certainly poll the members of the board, and give you a sense of the board as to where we are. And if we have to do a recorded vote, we can make arrangements to do that in proper method.
Bill, can I make a comment?
Yes, of course.
I think it's important to underline they're talking about doing this in July.
Yes,
Yeah.
absolutely true. So with that, I think, Joanne, you had mentioned that there are some people who wish to make a brief presentation. Is that Cheryl, do you have somebody on the line that would like to do that? You're on mute, Cheryl.
Melissa Laporto has her hand raised to speak.
Okay, please go ahead.
Go ahead.
Good evening, everybody. Can you hear me?
Yes.
Okay. My name is Missy Laporto, and I'm here on behalf of the leadership board of the Acton Boxborough Farmers Market. I know some of my other colleagues are also here. We want to thank you for having us with you tonight to talk about our proposed protocols for the season. We are hoping that these safety protocols will help us to operate as an essential service this season, while also protecting the public health. And we became aware recently of the proposal by Selby to have the market located at the Elm Street playground. And after considering it, even though our hope is to remain in West Acton Center, which has been our home for the last 11 years, we feel that this option is particularly helpful in affording us the opportunity to keep people safe as they work at and attend the market. We are educating ourselves on the protocols advised by the CDC and the Massachusetts Department of Agricultural Resources. And we used those guidelines to develop our own proposed safety protocols. And you'll notice that they primarily center around social distancing efforts and also minimizing the number of touches and sanitizing in various ways. We feel that because the market operates outdoors and also would help to shorten the supply chain and would carry fewer stops along the way for people to access their food, while also supporting the local economy. We're really hopeful that we can have a season this year, and we appreciate your help and support in these efforts.
Okay, thank you very much. Um, so I'll start off by just saying I've read the plan. I don't have anything to add. It looks fine to me, frankly. I think Cheryl has also reviewed it, and she's obviously the food safety expert. So I place a lot of credence in her review. But I'll ask if other members of the board have questions or comments. Dr. Jacoby, I see you've unmuted, so I'm guessing you might.
Yeah, I do. I have a couple of comments. One is the last bullet item on the first page where it says encouraging the use of gloves. Can we demand the use of gloves? That's number one. Number two, where it says no pets or unaccompanied children, I might be inclined to say no children at all. I mean, if the parents are busy buying stuff, kids can wander around a little bit and possibly go in back of tables and get into trouble. And my third question is, although it's probably not a Board of Health item, looks like this is set up around tennis courts. How about if the world changes and people can use tennis courts? They're going to miss one day every weekend of using tennis courts. So I think that should be part of the consideration.
Okay, thank you, Tom. On the tennis court one, I'll just try to address briefly. That is something that would be a selectman issue. The other ones, I guess either Cheryl or Melissa, if you would care to provide comments on about the gloves and the children.
So the thing with gloves is sometimes people think that they're the protect all, right? So I would worry that people would think like that. If they had provisions about changing them, how instructions on how to take them off and on, the washing the hands in between, I could be on board with that requirement. I do worry though, I see a lot of stores now that the employees had one pair of gloves on all day and is touching so many different products. And, we all know that virus can live on those gloves. So, as I forget who said it, Dr. Bill, I think, this is July. I think hopefully things will be different by then. But I do like, the plan that they've put before us. It's similar to what we're requiring of restaurants and grocery stores. I mean, so I don't have any issues. I think it would be difficult to tell a parent they can't bring their child, and I think as long as they're accompanied by a parent, I wouldn't have an issue with that either.
Maybe just no unaccompanied children or something along those lines. Dr. Jacoby, are you all set, or do you have something else?
Yeah, I'm fine. I mean, the issue with wearing gloves is, I agree with Cheryl that if people don't really know how, it can be a problem. But I think it would still protect the vendors themselves if they wore gloves.
Okay, thank you. Other comments or questions from members of the board?
Oh,
Yes, Mark.
I guess I have a few different comments. Uh, One about the food, I mean, would be no food prep and prepackaged would be better. So we don't have the issue where people would be needing to wear gloves to do the food preparation and things with limited sanitary facilities there.
So, Mark, if I can just jump in, I think the plan, unless it's changed since I read it, said there is no food prep, and it does encourage pre-pack, although
Yep.
it's not required.
Well, I guess that's the point. And I think one of my concerns is that there is very limited sanitary facilities. I mean, there's obviously no hand washing. There's a drinking fountain there, but that's the only water at the site. And that's trouble in itself. So I guess I would look to have a little bit more consideration for some of the sanitary things. But I think ultimately we really should just be delegating it to the department for their inspection and approval of the plans, and then obviously following up with them. Getting back to the comment about the unaccompanied minors, I think we should still be following the recommendations of Department of Public Health to minimize the number of people who are going out to these type of facilities to attend. So this isn't a family gathering and outing like it used to be. Unfortunately, this would be more of a essential service of providing appropriate food and an outlet for the local folks to be able to acquire that food in an appropriate manner. I guess the question about occupancy limits, I guess it probably looking at the tennis court, the way it's going around the perimeter, probably one-way traffic, and trying to do some of those physical means to prevent a lot of contacts between folks. But I guess the last comment is the location. I mean, it seems, I understand where they want to stay in West Acton, but wouldn't just up the street at the school be a lot bigger parking lot, and with water inside for hand washing? I mean, it just seems something to consider, that there are maybe other options. We know that that's going to be closed at least to the end of June, or this is July on, but I don't know if there's any other options for spots that could be done, because this looks like a fairly tight site, and hopefully we can find a solution that would allow the market to progress appropriately and to serve our residents the essential service.
Okay, thank you, Mark. Other members, Dr. Taylor, Mr. Cruz,
Hi,
Rita.
Bill.
Hi, Mike.
Yeah, I guess fundamentally my problem with this is that the farmers market is not an essential service. Like if this didn't happen this year, we wouldn't have any problems with essential services in town. So, I mean, that's my first concern with this. The other one is we are requiring barriers for stores, like the plexiglass or the plastic. We're not requiring it here. I think there are other requirements that we're requiring of stores that we're not requiring here. So I think it seems to me like this is a thing that people want, and they want to give it a bunch of exemptions over what we recommend or require for grocery stores. So, I mean, for me, I don't see this as something that we should go ahead with. I think maybe take a year off with the farmers market would be good.
Okay.
Well, I'd like to make a comment to that. First of all, this is outdoors. The grocery stores are in a more confined situation, and the chance of transmission outdoors is much lower than being in a building with So that's one big difference, and I think the crowds could be controlled, just as they do it in the grocery store. Is you have around the perimeter people waiting to come in, perhaps if it's too crowded, and someone would need to monitor that. But but I think it's doable, and I think they're trying to respect what they need to do to prevent transmission.
Yeah, Bill, if I may make one comment.
Which bill?
Bill McInnes. Dr. Beck, just observation to Dr. Bill, in that the Wuhan wet market was an open market. So, I'm not sure that that's relevant.
Okay. Well,
I
thank
don't
you.
think it is. I don't think we're going to be slaughtering any animals there.
That's a good question to raise, Bill, is they talk about certain things, no artisan or community tables. Is this food products only?
I don't know the answer. Maybe Melissa can answer that. Or Joanne.
I have no hand. Oh, hello.
Hello.
Hi. Thank you. So we understand one of the things that we've been talking a lot about is that, in operating as an essential service this summer and during this season, our market will be considerably different than it is during non-pandemic times. We are, cutting out all of the activities that would create any kind of gathering or browsing. And we're really just hoping to be able to provide consumers who need to eat with access to the farmers and the vendors who produce and grow and raise food and need that support. So we understand that usually the market has a very different aspect to it and very different feel. But we're really just hoping to provide safe access to good and local food through this season. So we would be, it's a very different market this season than it would be at any other time. And we certainly, want to take into account your concerns and suggestions.
So that doesn't exactly answer my question. Is it only food products? Yes or no?
Yes, it is only food products. We typically have an artisan. We typically have other kinds of things available, but we are going to have just our vendors who produce food. Yes.
Just food products only, and only for products that will be distributed and taken off site. Nothing to be eaten or sampled else on site.
That's
yes,
right.
I believe that's what it says. Yes.
Yes, that's right.
And then all of the vendors. I'm a little concerned about how they would set up and shut down and all the other protocols. I think you need to make sure, because if they're tight space, usually when you're setting up things, you're walking around the tables and dropping things off and vehicles. So I think there's a lot more logistic things that need to be done. But the question is that a Board of Health issue or is it more a department? I think that's, at this point, it's a department concern for the plan and reviewing and making sure it's appropriate.
Okay. And just one observation, I guess I would add, at least when I read the plan, it said all of the vendor tables will be 6 feet apart. And I heard Mike say about plexiglass like I have in supermarkets. But I think what we're trying to do is accomplish the same thing, or not we, the farmers market is trying to do is accomplish the same thing by using distance as a method of control.
I think the point Mike is making is that it's the barrier between the vendor and the customer. So they're minimizing that, because usually when you're paying and handing things, you're close proximity. So I think that's what he was commenting about. You're having the separation. Obviously 6 is good, 10 feet is fantastic, but the interaction between the customers and the vendors, trying to have people not congregate in front of a table, looking at what they want and selecting things, and then interacting for the time period. It's walk up, get what you want, and keep moving, rather than a typical market. It's more of a production.
Yeah, and others can speak to it, but at least when I read it, it said that they were going to put a table in between the display and the customer, just to be able to keep the two apart. And it looks like they also have a 6-foot separation between the vendor stalls and the customer walkway. So at least my reading of the plan was they were trying to keep, as you just said, Mark and Mike, the vendor and the customer, also 6 feet apart. They also encouraged prepay, uh, establishing some sort of credit card online or payment online, so you wouldn't have to exchange money, things like that. So um, certainly, it seems to me very reasonable suggestions, and I think they've tried to account for some of them anyway. I don't mean to be an advocate, but like I said, I read the plan and it seemed like a pretty good start. Um, Dr. Bill, did you want to add anything else? Are you generally um, in favor, not in favor?
Well, I think we're going to be in a much different place in July than we are now.
Let's hope.
But I think being outdoors, there is the concern if you get a big crowd and how that would be managed because the vendors will be at their tables. But that's the only other thing. I think they're trying to respect the other issues that we've put in place in grocery stores, and I don't have a major problem with it.
Okay, thank you. And it, just Rika, did you wish to add anything, or are you all set?
I'm all set.
Very good, thank you. So, in keeping with what we had suggested we could do, Dave. Yes, sir.
Sorry. I just want to say a couple of things. So initially, I was very skeptical about and remain skeptical about the Pearl Street location. Not only was there only about 15 feet in front of the booths, but it didn't lend itself to one-way traffic. And there were other problems I thought here too. I think the farmers market folks and the town have done a good job here. There's 25 feet or more in front of the booths here, and it is set up so that it's conducive, and they're saying they're going to put in one-way traffic. So it's a much better situation. There will be, as I understand it, 3 hand washing stations here. So people can go out and wash their hands, either the vendors or the customers. I think that this area, and I understand, to Mark's point, that there is, money changed here or exchanged here if they don't do the prepay system. But it's much less cramped than the produce section in a grocery store. Either the grocery store aisles are less than 6 feet, I think. And you handle the produce and you walk right up in front of the produce. So I think they've done a really nice job in this plan, and they've at least done all the things that we talked about at the last Board of Selectmen meeting. Thank you.
Thank you, Dave. So, in keeping with what we had announced in the beginning of just polling the sense of the board, sounds like maybe we can use like a 1 to 10 scale, where 10 is you're fully satisfied with the plan and 1 is you're completely not satisfied with the plan. I will ask if members would mind giving me a rough estimate of their position. So I'm going to pass over Ms. Becerra. The next person in line is Dr. Jacoby.
Yeah, I would give it a 7.5.
All right, thank you. Mr. Cruz.
I think this is crazy. I'd give it a 1.
Okay, fair enough. Dr. Taylor.
I would say I'd give it an 8.
All right, thank you. Mr. Conaby.
I would say a 6 to 7. I think the plan's got a few more things. I'm concerned about the spacing, the hand washing 3 station, lack of parking. I think it's a good start, or great start, but I think looking, as Mike said, at some of the other facilities like this for some of the requirements, and then trying to do it, but most importantly, making sure that the plan and the inspection is done by the department so that it does able to be proceeding in an appropriate manner.
Okay, thank you. Dr. Singh.
I would give it a 7.
Okay. Thank you. So as I sort of tipped at the beginning, I have high confidence that the department and the farmers market committee working together can achieve a workable result that is no worse than going to the supermarket, and perhaps maybe even better. And I guess I would disagree with Mike in one respect, is I do consider this an essential service. I mean, getting fresh food is whatever the venue. I don't think it's up to us to determine if it's the correct venue, but fresh food is essential, and these folks are providing fresh food. So I would think it fits in that category. So I'm going to give it a 10, just because, like I said, I have confidence that the department um, can craft a plan that will be acceptable. The issues of parking and use of public facilities and so forth is fortunately a selectman issue, and I would defer to them on how to manage that. So um, I think that covers the members of the board, and we've had a chance. It sounds like the consensus opinion, if I average the scores, is that people think we've got a pretty good start. There's still work to be done. There's some bases that still need to be covered, but it looks like the general consensus is it's achievable with a little modifications. If I'm misrepresenting anyone's numerical score, please, this would be your opportunity to explain why I'm wrong. Okay. Well, I'm not hearing anyone. Mr. Martin, does that give you enough to go on for the moment?
Yes, thank you, everyone. And if people have specific concerns they'd like the Board of Selectmen or the Farmers Market Group to address, please send them along. I mean, I heard the comments today about enough hand washing stations and how's the parking going to work and things like that. So I understand those. But if there are other things that people want to bring up, please send them along.
Yeah,
Okay.
I did have one thing to add for that, David, and it would be helpful to have someone managing the crowd. The vendors won't have time for that, but to keep people from congregating around one area and keep them going by, making their decisions and moving on.
Okay.
Sort of traffic control.
Exactly.
Okay.
And also, if we can add face covering for the vendors as well as for the customers who are visiting there.
Yeah, I think that's in the plan here, if I was not mistaken. But I'll remember that, Dr. Singh. Thank you.
We
Okay.
just say that we'd like to have the same requirements for this as the other supermarkets and grocery stores, just to be consistent, I think is the simplest way to do this. So everyone is on the same page and it's appropriate for this essential service. And last, I think we need to be cognizant of things may change between now and July, hopefully for the better. So this is all dependent on what happens in the future. It's based on our best guess at this time.
Okay. Thank you. If there's no further comment, I'd like to move to the next agenda item, which is to cover any other updates, Cheryl, that you might be aware of.
Can we just go back to the last subject? So I just want to understand that you just want a little bit of an improvement on the plan that they've submitted with some of the suggestions that have been spoke about tonight, right? Is that what you're looking for from the department?
That's what I heard, but I think it
Okay.
wouldn't be up to you to make those changes.
Okay. Okay. I just wanted to make sure that I was on the same page. Okay. I don't have any other updates. There is one raised hand from the last subject from the member of the audience, if you wanted to address that.
Yes, certainly.
Call in user number 1. Go ahead.
I just, since you've already seemed to have given them a go-ahead and the farmers can plant their food, I will submit the rest of my comments online. Thank you. I'm very supportive of this.
Very good. Thank you.
So Bill, I do have an update I'd like to share.
Sure. Please go ahead.
And up until now, all the cases have been certified by a laboratory test. So the number of cases and deaths related to COVID-19 is an underestimate. Now, CDC has a national reporting system, and they developed that with the state health departments. And they've come out for some new recommendations about what a case should be considered. And they have 6 items based on a lot of input from the providers about what kind of symptoms they're seeing. The initial case definition was fever, cough, and shortness of breath. But now they're adding chills, muscle pain, headache, sore throat, and loss of taste or smell. And so a combination of things, a provider could, if they had 1 of the fever, cough, and shortness of breath, and 2 of these other new areas, they could report them as a presumptive case. And that would be a national report coming from the local and state health departments. And the advantage of this is we'll start seeing more of the actual case. The case is there, community spread, the problems we've had with testing. So that will increase our numbers, just because it doesn't have to be laboratory confirmed.
Fair point. Thank you.
And Cheryl, I can send you a list of those for the minutes.
I actually had that on my update to give tonight. So thank you for bringing that to my attention. I had it on the second page of my my update list, and I never flipped the page. So thank you for sending that out. I've seen that, Dr. Bill.
Yep, thanks.
Okay. Well, at this point, I'll ask members have.
Could you repeat those symptoms, Bill?
Yeah, I can. The ones that are new have been reported by a lot of providers, and so they're considering these as a presumptive case. The new ones are chills, then repeated shaking chills, muscle pain, headache, sore throat, and a recent loss of taste or smell. And then fever, cough, and shortness of breath. Having 1 of those and 2 of the new ones would make you a presumptive case, as long as you don't have some other diagnosis that is more likely than COVID-19.
Good, thank you.
Okay. I ask, is there any other items of interest or business for the board? Or from members of the board? If not, I'd just like to also announce our next meeting. Will be a special meeting. This being a regularly scheduled meeting. A special meeting would be a week from this coming Wednesday. So that would be May 5th, about?
6.
6.
Yeah.
Okay.
6.
Day after Cinco de Mayo. Which used to feature Corona beer, but that's just an aside. Anyway, okay. Like I say, hopefully everyone can make that meeting. If something comes up or doesn't come up between now and then, we'll adjust accordingly. Mr. Conaby, I see you've unmuted.
Do you want to do the minutes?
Without an agenda in front of me, I'm completely lost. But yes, that's a very good point. Thank you. We should turn our attention to the minutes of April 22nd, was it?
Yes.
20. Thank you. I did actually read them, and I have no comments. They look fine to me. I ask, do other members have comments or corrections for the minutes? Okay, I'm not hearing any. Does anyone wish to make a motion to accept the minutes?
So moved.
Thank you, Mr. Conaby. Is there a second?
I'll second it.
Thank you, Dr. Taylor. We have a motion made and seconded to accept the minutes as written. All those in favor, please say aye.
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 All right, I think I've got everyone. I also vote aye. So minutes, I'll ask, are there any nays? Hearing none, I announce the minutes have been passed unanimously. Thank you. So Mark, did I missing anything else on the agenda, or are we good for adjournment?
I don't have anything further.
I do have a member of the audience with the raised hand. I don't know if you want to.
Sure.
Okay. So Jackie Ingram, I'm going to allow you to talk. Please state your full name and your address. Go ahead.
All right. Thank you, Cheryl. My name is Jackie C. Ingram, and I reside at 58 Washington Drive, Acton, Patriots Hill neighborhood. And my question is specific to the pool associations. So the neighborhood pools, there's been some guidance that we've been trying to follow, mainly at the state level. Is there any local guidance from the Acton Board of Health on when we anticipate we should be opening pools, if we should be opening at all?
I can just tell you, I don't have any information really to add. We're still waiting for further guidance from the state as to exactly what's going to happen and when. But I haven't heard anything related to pools, and I'd have to say I haven't given it a heck of a lot of thought, so I don't have an opinion to share. I don't know if any other members wish to speak to it. If not, I would just suggest, stand by for news. We're trying to get this concluded as fast as we can, but as I think the doctor at CDC said, we're not in charge. The virus is.
Completely understand. Thank you.
All right. Well, in that case, if we've reached the end of the agenda, as Mark is keeping me on track, perhaps he would like to make a motion to adjourn.
So moved.
Is there a second?
Second.
I'm sorry, who said that?
Dr. Jacoby.
I did. Second.
I see. I hate to tell you this, Dr. Jacoby, we have a full board tonight, so
I know, but nobody else was speaking up.
I tried to, but I didn't unmute myself.
Okay, then it almost reminds me of an old Three Stooges routine, which we can discuss some other day. Very good. We have a motion made and seconded to adjourn. All those in favor of adjournment, please say aye.
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 Mark, I'm assuming you're in favor, but you're mute.
I'm on. Aye.
Okay, that's a majority of the board. Dr. Taylor, I assume you're okay with that as well?
Yes, definitely.
All right. In that case, it's unanimous. We stand adjourned. Thank you, everyone, for your time and your insights and your consideration. I keep waiting for the day that we can say that we're positively on the downslope. I think we're still going to have to wait another week, but that day I hope will come. Anyway, thank you again, everyone, and good night.
Good night. Be safe.
Good night.
Good night.
Aye.